welcome. You're watching Business Today Television. I'm Sakshi Batra, and this is our latest offering, What's Hot. Today, we turn our attention to an invisible killer, one that's filling our skies, creeping into our homes, and choking our children's future. The air we breathe has turned toxic, and the numbers are painting a dark picture. Nearly 43% of all health insurance claims are now linked to pollution related diseases, and those are coming from children below the age of 10. Yes, that's almost half of all the health insurance claims coming for all the pollution related diseases are being found in our youngest citizens of the country. These are not just statistics that are coming away from any faraway land. They are from all our neighborhoods Delhi, Lucknow, Jaipur, and even Hyderabad and Bengaluru as well. Doctors are calling it a public health emergency. Parents are calling it helplessness. And as the data shows, India's smallest citizens are bearing the biggest cost of air pollution. Let's welcome two of our special guests to decode what's the current situation, how grave the situation is, and how do we solve it. Let's look at welcoming Mr. Amit Chabra, Chief Business Officer, General Health Insurance and Policybazaar, who's given up an entire report on what exactly is the pollution data telling us at this point in time. We'll also welcome Dr. Krishan Chugh. He's the Principal Director and HOD of Pediatrics at Fortis Gurgaon, and he's also with us on the program. Warm welcome to both of you, and thank you so much for taking the time out for this very important conversation that we are going to be having. Let me start off with you, Ms. Chabra, and I want to understand from your own Policybazaar report that has now talked about that almost half of the health insurance claims, when we are talking about the pollution-related health insurance claims, are actually coming in by way of children. Give us a sense of what exactly have you found, and you've also said that there is a jump of nearly 14% after Diwali due to the deterioration in the air quality index in these kind of health insurance claims as well. Go on, sir.
Sure. So I think it's quite unfortunate, but what's happened is we saw an influx of pollution-related claims coming in the last few days. We also and this was not surprising because we saw a similar trend last year and the year before, and over the last many years. What is happening is that as the pollution sort of settles into Delhi and other cities, people do so what two things happen. One is there are some some health conditions which sort of which come up because of that. So people find breathing difficult, there is a lot of chest congestion, there is a lot
Right.
of breathing problems in the eyes. So a lot of new problems crop up in, and this is specifically kids, children, below in younger ages, where a lot of new problems crop up. That is one part. The other thing that also happens, and that is more linked to the elderly or in the higher ages, is that existing problems also become a bit tough, right? For example, if you are already an asthma patient, then this pollution is terrible for you. So your existing asthma also becomes worse, and again you would need some sort of breathing support at times, nebulization, hospitalization support, etc. So it's both ways. One is new illnesses or new problems cropping up. That is where kids take a lion's share of that, because they do find tough to adapt to a scenario like this. And second is which is more in the elderly, that their existing problems, they could be linked to hypertension, could be heart problems, could be breathing related problems, lungs related problems. They become worse, and which again needs assistance in terms of hospitalization support. So these are the two different realities that we have seen in the last few days, and the trend has been fairly similar across the years. That as soon as the pollution settles in, and this typically happens in early November, but as the pollution settles in, it becomes a trend every year that pre-November and post-November, and Diwali just happens to be around that time. We see this we see this pollution becoming very very real, and hence the increase in claims as well.
Absolutely. Let's actually get Dr. Krishna as well, on the program. Dr. Krishna, help us understand what's the on-ground picture. Have you seen a marked increase in the number of patients, especially the younger kids, also complaining of pollution related diseases? What kind of complaints are you seeing? Is there also an increase in health insurance claims related to pollution that you're facing at this point?
Well, yes, it is true that in these days we are getting more of such patients who are uh, children who are having respiratory problems mainly. They have breathing difficulty, and like Amit said, some of them are coming to us for the first time. They have never had a breathing difficulty in their lives. They may be just 2 years, 3 years, 5 years old. The younger the child, more the difficulty because their airways are already very narrow. And when this kind of congestion occurs because of pollution and such things, the airways become further narrowed. There is a whistling sound that they start producing, what we call as wheezing. And with that, they have they cannot eat, they cannot drink, so they have to get hospitalized. Their oxygen saturation starts dropping, and they cough a lot. All these put together puts them in a situation where the parents have to bring them to the emergency many times and to our OPDs, and we decide, okay, this child cannot take it anymore at home, and we have to admit the child in the hospital. The other component is that when they do get admitted, if it is not the pollution period, suppose it's an asthma patient who has a worsening these days, on another part of the year, the response to medications is very good. Within a day or two, the child can be discharged and sent back home. In these days when the pollution is more, somehow the receptors where in the airways where our medications go and work, they become somewhat resistant to the effect of the medication. Medications take longer period to settle, to show their effect, and that's why the hospitalization tends to get prolonged. Yes, some of them will develop in the concurrently they will develop, let's say, viral infections or other infections, which makes the situation even worse. That then, of course, more antibiotics and more medications are required. Some of them will need steroids also. So all these put together is a kind of cost on the health of the child, not only for immediate period of next few days, or but it could be for a long period of time. In fact, if this goes on happening every year, we are concerned that when they are young people, or even let's say go to age of 30, 40, their lungs may not be as good as they would have been if they have been living in a better non-polluted areas.
Okay. Amit, could you also just detail for us out of the entire basket of health insurance claims that you on an average get in this kind of a period, October, November, December, what is the percentage that is actually coming in which is completely pollution related? And have you seen an uptick in that as well?
Yes, so the right way to compare, and as you were saying earlier as well, the right way to compare is to look at pre-post in terms of percentages. And what we have seen is there's almost a 14% odd increase in claims which are directly attributable to to respiratory problems. See, because as the doctor was also saying, this affects the body in multiple ways. So some of those effects may actually be indirect, but what we've seen is the direct impact, where you're having respiratory tract problems, breathing problems. There we have seen almost a 14% increase in pre-Diwali and post-Diwali, and this has been fairly consistent in the last few years. So there is a
You've also
fairly
mentioned
direct
8% of total claims. Explain to us that 8% of total claims in health insurance. Explain that.
Sure, sure.
Yeah.
See, so health insurance claims come for various reasons, right? They could be
Yeah.
accidental claims, they could be viral infections, they could be digestive problems, etc., etc., heart problems, cancer, a lot of those. Out of 100 health insurance claims that come, typically 7 to 8% are because of respiratory problems or problems which can be directly linked to air pollution. Now the thing is, this number goes up further in days like this. So obviously, because the conditions are quite severe, and hence there is an impact. The I would say so that is one point. My larger worry, and as doctor was saying, I think the larger worry is that the the respiratory health gets worsened over time as well, right? What we are seeing is only a very short term impact right now, because this pollution has probably worsened more in the last, probably last
Yeah.
5 7 years.
Very important point.
But in the I would say, what happens when these children become 20, 30, 40, and maybe in the senior ages, it will become even tougher for them, because their lungs probably have been attuned to a certain level of pollution, and they're not as strong, or not as, they are fairly weak compared to,
Very important
let's say,
point.
where we all are. So it's a larger point. I don't know what the answer to that is, but yes, it's
Absolutely.
quite a
I'll
it's
bring
quite
in Dr.
concerning,
Krishna
quite a
also
concerning
in this
situation.
point, Amit. A very important point that you made. One, Dr. Krishna, what we are seeing right now is, yes, cough problems, wheezing problems, increased amount of asthmatic kind of cases. I want to understand, is there going to be a larger, longer implication of people who are staying in these kind of areas which are filled with this toxic air for at least 2 months, 3 months every year, especially in children? Do you see long term impact as well?
Yes, you see, children have what we say developing lung. The first few years of life, maybe it's up to 8 to 10 years of life, their lungs are developing. When they are, we call this as an insult to the lungs, to the developing lungs, because of these gases and the particles that go into the lungs. Now, these will affect the growth of the and the development of lungs into a more efficient organ. Suppose this is the size of the lung, it is possible it will still remain the same, but its efficiency will get compromised because of these exposures. And as the child grows, these lungs have lesser number of units that are working, and hence the, let's say, the overall capacity that the lung has will become somewhat lesser, which means, suppose a patient, a child who has not been exposed to this kind of pollution over the years, gets to age of 20, he can then run, let's say, 5 kilometers without getting tired. Where one who has been exposed may not be able to do that much, may get tired much earlier. So that kind of long-term harm we are looking at on the lungs.
Okay. Amit, to this point, I actually want to bring in your expertise and help us understand from an expert point in the insurance space. Are you already seeing that companies, insurance providers are looking at this aspect very clearly and are also penciling in all of this in the premiums that are charged to all the citizens in Delhi, in cities where we have all this problem, Delhi NCR? How are you looking at that?
So not so much right now, to be honest. We haven't seen that. So just let me give you an insurance perspective. The premiums in Delhi, in the larger metros, be it Delhi, Mumbai, Bangalore, they're already higher than the rest of the country. But typically they're higher because the cost of hospitalization is higher. There are better hospitals here,
Okay.
better facilities here, and hence the cost is definitely higher. We haven't really seen any specific impact due to air pollution coming in yet, but I think it will come. It's a matter of time, because see, what is another interesting statistic. The direct claims attributable to air pollution, there the number of days of hospitalization is typically not very high. It would typically be for 3 to 5 days. They are not very expensive claims as well, compared to, if you look at, let's say, heart problems or cancer or knee replacement or stuff like that. However, also the problem, that one can foresee is that respiratory issues that are happening right now will have longer term impacts, which may mean that these consumers who live in, let's say, these metros today, they will probably have a larger healthcare cost in the future, because a lot of the body parts are getting impacted. It's a slow burn. It's not an immediate impact. It's a slow burn. So yes, in the future we may see that, and it may be linked to air pollution and larger metros. We may see that there may be a sort of a loading levied or a price increase. Or what would happen is that the insurance premiums will become a bit expensive in these metros. That might happen, but as of now, no, there is no such trend.
It might happen. As of now, there is no such change. Dr. Krishnan, are you also seeing increased amount of cost when it comes to respiratory, cardiac related cases? Have you seen a treatment cost increase as well? Hospitalization bills, if you could help us understand for an average family, the usual, healthcare bills, have they gone up because of this as well?
as I said, when there is no pollution, the response of a child to a medication in a respiratory problem is faster. So, which means the stay in the hospital is shorter, and also the number of medications required, and so the respiratory support, the oxygen therapy, and all would be for a shorter period of time. And when it becomes longer, obviously the bills go up. If it's a 2 days or a treatment and becomes a 4 days treatment, you actually doubled your bills. So in that sense, yes, it is an extra cost to the family, and year after year this happens. So I don't know how easily these kind of families would cope up, but yes, it's a problem that one has to kind of now onwards in future take into account when we are planning our, let's say, budgeting our family budgets.
Okay. If you could come in here, Amit, and tell us, what are you looking at in terms of the healthcare bills? How have they gone up? Have you put out that as part of your report as well?
Well, yes, there has been there has been an increase because, as we were discussing, it's an added complication. So there is a marginal increase. Yes, that is there. But yes, so it's there. The answer to your question is there. But I would definitely urge, all the view or to all the viewers. I think, see, one is how to mitigate the pollution. I think that is one point, and there's been a lot of talk overall on that. It's also very important that one must have a health insurance policy here, so that if a claim comes, you're able to at least take care of the financial impact of it, because the situation is already quite grave. So yes, it is there. The costs have gone up. The number of claims have also gone up because of the air pollution. So it's the
So,
reality.
Amit, do you think, one needs to know also what kind of health insurance policy one needs to take? Can you give us some insight on that as well? When we are looking at, if you are staying here, you have no ways of shifting your base. You are going to be probably facing this. From last 10 years, situation has only gotten worse when it comes to pollution. For those who cannot shift their base, for those, there are many that are already thinking about having a future elsewhere, thinking that this will not get resolved. But those who cannot, what should they do? How should they select their health insurance?
Sure, I think it's a very, very simple answer. See, health insurance does not differentiate between air pollution related problems and everything else. Any hospitalization for health insurance is the same. The only thing that I would urge all the viewers is, you must buy a health insurance, buy adequate sum insured in your health insurance policy. See, because hospitalization is getting expensive, claims are becoming more frequent, so the cost is going up, from an insurance angle. So one must make sure that you have adequate sum insured when you're buying your health insurance policy. If you stay in one of the tier 1 cities like Delhi, Mumbai, Bangalore, Hyderabad, and the likes, you must at least have 10 lakhs per person sum insured in your family. So let's say if you're a family of two adults and one child, then you should look to have at least 30 lakhs of sum insured, because God forbid if something happens, you don't want your sum insured to finish up. The cost of hospitalization has gone up. We now very regularly see claims of 40, 50, 60 lakh rupees. It's not, 5 years back it was a very, very rare scenario to see a large claim. Now it's become extremely common. There are hospital bills of, which go into tens and tens of lakhs. So having adequate sum insured, so 10 lakhs per person is a good rule of thumb to have. That is the
Okay.
sum insured everybody must at least have. The good news is, beyond 10 lakhs, the increasing sum insured is actually not very costly as well. So just to give you a rule of thumb again, let's say if the cost of 10 lakh sum insured is 100 rupees, the cost of 1 crore sum insured, which is 10 times 10 lakhs, is going to be about 20 to 30% higher only. So it's not that it becomes very expensive to upgrade to a higher sum insured.
Sure.
The ideal thing to do is to take a higher sum insured and be protected at
Very
least from
important.
financial angle.
Absolutely. Dr. Krishnan, I'm going to come to you now. Help us devise a toolkit for people who have their children, who have to go to the school, who have to go out in this kind of pollution. At homes, we are all now used to of using air, purifiers, but how much do they work? How much do they not work? We don't know. Help us devise a toolkit. What is essential for us to keep ourselves, whatever we can do, safer than this pollution?
There is no general formula that is going to be really, really very effective because children have to live their life and they would continue to live that way. You can't ask your child not to go out at all for months. This period is going to last for 2, 3 months maybe. They have to. Yes, what we can do is choose the afternoon time, when especially the sunny day. Sunny days are sun is there on the top, but it doesn't reach the bottom, this ground level because of pollution. That is also a point. But still, whenever there is some sun, that is the time when the pollution effect would be the least harmful for the child. I'm not saying it will not be harmful at all, but it will be the least harmful. So that is one point. Then the second is that when they are out also, they are playing, maybe very vigorous running and all, which they would be probably a natural part of their play, can be cut down and they can be made to play those games or be a part of that kind of activity which does not demand too much of oxygen suddenly inside the body. Then those who already have some health issues, respiratory issues, should take their medication very regularly and maybe an additional dose in under the instructions of their treating doctor before they go out for play. So that would be when they are out. Then the other point is that they have to go for school also, unless school allows them hybrid or something, which has happened in Delhi now. But otherwise, if they have to go to school, see that the exposure to outdoor pollution is minimum, which means, for example, when you go in your bus or a car, the windows are closed, and we try to take a route which takes us minimum time on the road. School timings cannot be adjusted very much. Most of the schools start very early in morning, and mornings are not good at all for polluted areas. But probably we don't have much of an option there. Wearing mask is something which can help in only reducing the large particles from entering our airways and the respiratory system. The smaller particles and the gases which are harmful for us will continue to enter through the usual mask that we wear. To say that we should be using N95 mask, well, I think it's impractical. It was COVID times were very different, and even then we were not going out. When you are out, you are coming in contact with the air here all the time that you are out. How can you keep wearing mask, and how can we ask our children to keep wearing it and wearing it effectively is something I think is
Correct.
not very practical. So mask is also, well, if you are in the worst area for a short period and for effect of reducing the larger particles from entering in, yes, you can wear it, but otherwise probably it does not have that good effect that we would like it to have. Then at home also, if it is seen by almost everyone that as soon as you open the room, the level of pollution goes up in the, let's say, in the air purifiers that we have installed at our homes.
Right.
So if we can, yes, these air purifiers can be useful, most useful for those smallest of the babies who will be more or less confined to a single room throughout the day and night. There, yes, it will have. For a child of older age group of 3, 5, 7, 8, 10 years who will be running around in the home and not likely to be sitting in one single room, these will have
Yeah.
limited advantage. And yes, at night, if the air purifier is on and for those many hours, you can expect that the pollution effect would be somewhat mitigated, not really a big effect. So that would be at home. At home, whatever additional things that we are doing, let's say a lot of cleaning at home, like Diwali is. So those kind of things which are when they are being done, probably we ask the child to go to a nani's place or something and come back once those have been done. So the worst periods we try to avoid. Worst period of the day, worst period of the month, try to avoid that. And whenever possible, yes, use mask, but remember that it has very limited advantage.
Limited advantage there. Okay, Amit, do help us understand what are the other key insights from the report that you have shared that we must know, our viewers must know, when it comes to pollution related health insurance claims that are coming in, the cities that are worst affected, anything else that we have missed asking you that you should definitely highlight for our viewers?
Sure. I think in terms of cities, we have seen a clear trend that the larger as you would expect, it's sort of expected that the larger metros see the maximum impact, because that's where the pollution is also probably the most compared to smaller towns. The As I was mentioning earlier, the cost of these hospitalizations related to air pollution is also, while it's gone up, but I think that is also in manageable levels. I think largely the most important points we have covered. The only one thing I would mention, which is probably, I would say, important for all the viewers beyond the report, is that a lot of people think that breathing problems, or breathing issues that one faces, which may even lead to hospitalization at times, are very common issues. So when let's say you are buying your health insurance policy or renewing your health insurance policy, it's very important to also inform the insurance company about your existing condition. So if there is any existing condition which is related to breathing, it must be communicated to the insurance company at the time of buying or renewing your health insurance policy. It ensures that your claims are seamless and there is no problem, because at the end of the day, this is a existing health condition for a lot of us, unfortunately. If we do face breathing difficulties or problems or any lung issues, so I think communicating that is very important. Yeah, apart from that, I think most of the important
Sure.
points.
Okay. All right. Dr. Chug, any last word that you would like to highlight for all our viewers?
Well, we have to, most of us, as Amit says, as you also pointed out, can't change our base. So we have to learn to live within this, and for not just for a day, maybe for several weeks. So work out our schedules, whether it's a school, whether it's at home, whether it's a sleeping time, all those, and follow those points every single day so that we minimize our effects. Totally safe, well, may not be possible.
Okay, thank you so much, Dr. Sheikh, and thank you so much, Mr. Chabra, as well, for sharing all that insight. Viewers, of course, what we have got to understand is that one, the data definitely points out to increased amount of health insurance claims when it comes to pollution related health diseases, especially in children, which are making up for almost half of the health insurance claims related to pollution right now, which means that we need to take extra care to protect our children at large. Of course, the larger point will always be for the policymakers to put all energy and efforts to ensure that this public health emergency is catered to at an urgent priority basis. But at the same time, Dr. Chug also pointed out all those measures that you can take on your own now to protect your family members at this point in time are extremely essential. Even though the measures might be very limited in being able to help in aiding or curbing pollution at large, but all those essentials also need to be done very much on our end as well. With that, we wrap up today's edition of What's Hot, but do stay tuned as market coverage will continue on the other side as well. And of course, in case you have any questions about the stocks in your portfolios, I'll be back for another edition of Daily Calls at 12 noon for that.